Hey guys, so for my portion of teaching, I'm teaching about basically just ventilation, breathing, and the different pressures and the different muscles that make breathing possible. So to start off, we'll just define what ventilation or breathing really is. It's just the movement of air into and out of the lungs. In order for air to move, there has to be a difference in air pressure. And that pressure is known as the pressure gradient. So just always remember that air will flow from a region of high pressure to a region of low pressure. So in order to, for example, inhale, there is a difference in the pressure from outside of the body, the atmospheric pressure, and the pressure inside the lungs. It's lower in the lungs, and therefore you inhale coming from a high from the outside and inhale inside to a lower pressure, if that makes sense. And the ability for air to do that, airflow, it is affected by the amount of resistance in the passageway for the air. So there is a law, and I don't even know how to say it. Maybe Poy's law. I'm probably totally killing how to say that, but this law by this person, the formula is the airflow is equal to P1 subtract P2 divided by R. And the P's just represent the different air pressures, so pressure 1 subtracted by pressure 2, and you divide that by R, which is the resistance. So like the diameter of the tube, and the diameter of the tube has greater influence on resistance. They are inversely proportional. As diameter goes up, then the resistance will also go up. So remember that. And the greater the difference between the two pressures, and the lower the resistance in the tube, the faster the air will flow. So for inhalation of air, the atmospheric pressure is greater than the pressure inside the lungs, like I said. So air enters the lungs. And then we have pressure differences in the thoracic cavity, and the respiratory pressures are always in relation to the atmospheric pressures. So just remember that. So the pressure outside the body will always be considered zero, no matter what the elevation may be. It's always just at zero. And then the pressure on the inside, it's called the alveoli pressure. That is at a -1. And so it always seems to be a little below the atmospheric pressure. And then you have the pleural pressure, which is usually at -4. And the reason why the pleural pressure is lower is because of a few different reasons. There's the lymphatic vessels, which is kind of like a vacuum, so it's continually sucking. And then you have the forces that pull lungs away from the thoracic cavity wall, that causes lungs to be the smallest size as possible. And you have the elastic force and surface tension exerted by the water molecules inside the alveoli, and they're attracted to each other, so it causes them to do that. Having the alveoli in a negative environment makes it easier to expand. If it weren't for the difference between lower pleural cavity pressure and the alveolar pressure, the lung would collapse. Differences between these two pressures is known as the transpulmonary pressure. So for example, if you have a balloon, it's easier to blow up when it's deflated and you're able to blow inside it. But it can also do the same thing, just the opposite. So if the balloon was in space and there was more inside the balloon than outside, because there's no oxygen in the air in space, it will also be able to blow up that way. So the larger the transpulmonary pressure, the more the alveoli and lungs will be inflated. And there's a couple things that that can cause problems with these different pressures. One of the things is called pleuritis. It's an infection of the pleura and may cause excess fluid to build up in the pleural cavity. With them no longer attracted to each other, the lung collapses, or if air is introduced into the pleural cavity, whether it's from you getting stabbed or a gunshot, the lung will also collapse. Then you have something called the pneumothorax, which basically means that there's air in the pleural cavity. And then tension pneumothorax is air is allowed to enter the pleural cavity during inspiration, but not exit during expiration. And this causes a decrease in the venous return and also cardiac output, and can be a very scary thing to have happen. And then there's the atelectasis. I'm terrible saying that, but it just means that the alveoli are becoming underdeflated, which also is not good. So those things can cause problems with ventilation. And then just for the last part, we're just going to talk about the difference between inhalation and expiration. So inhalation is when you breathe in and your lungs expand, and then expiration is when you're breathing out and your lungs go back to the normal size. So in normal conditions, just an average of breathing per minute is just 12 breaths. And then you have the Boyle's law, which is P equals K over V. P being pressure of gas, the K is just the constant, and V is the volume of gas. And this law just shows that there is an inverse relationship between the pressure and volume. For example, a bike tire, because the volume is smaller than on the outside, the atmospheric pressure, it increases the pressure the more air that you put into the tire, because you're increasing more oxygen to be in that tire, but the volume is staying the same. And so with the volume being that size, the pressure increases. And there are muscles that change the size of the thoracic cavity in order to breathe in more and be able to exhale more. And the main muscles for just regular breathing are the diaphragm and the external intercostals. 2/3 of the volume increase is from the contraction of the diaphragm. And then the rest of it comes from the external intercostals, which those are part of the abdominal muscles, and it elevates the ribs and sternum. And the external intercostals are also important for preventing a collapse at the cavity during inspiration. And then for quiet expiration, the diaphragm and the external intercostals just relax to their normal size. But if you were trying to force expiration, then you would have some muscles that help do that. And those muscles are the internal intercostals. And those just contract, causing a more rapid rib depression. And then you also contract your abs, which push organs against the diaphragm, having it cause it to relax quicker. So that's that. Just remember the Boyle's law and what it means, and also the other law, the name I cannot pronounce. And know the different pressures and the numbers. Alveoli is -1, atmospheric is 0, pleural pressure is -4, remember those. And when you breathe in, or when you're breathing in, it causes the -1 of the alveoli pressure. When you breathe in, it causes a -1 to go to 0. And then when it goes to a +1, that's when you exhale to bring it back down to a 0. And then it goes to negative, and that's how that process happens of breathing in and breathing out. So it goes into the alveoli of the lung. And then here's just a picture from the study guide of an example of what happens when you inhale and exhale. Looking at the diaphragm, this right here, when you inhale, the diaphragm will go down, and then here are the intercostals, external intercostals, they will expand. And then just the opposite for when you exhale, the diaphragm will go back up to its regular position, and then the ribs will just go back to its normal spot. So hopefully that was able to help you and clarify a few different things. Thanks.